Do you know about Gold?
Gold jewelry?
No, not exactly. Gold is an acronym for the Global Initiative of Chronic Obstructive Lung Disease. Gold has members from all over the globe to serve as a network to disseminate and implement programs for managing and preventing COPD. Let's look at my pocket guide. It was last updated in 2015.
One of my family members has COPD. He has trouble breathing. How can Gold help?
Chronic obstructive pulmonary disease, COPD, is a major cause of morbidity and mortality throughout the world. Much has been learned about COPD since the Global Initiative for Chronic Obstructive Lung Disease issued its first report, Global Strategies for the Diagnosis, Management, and Prevention of COPD in 2001. Treatment of COPD is now aimed at immediately relieving and reducing the impact of symptoms as well as reducing the risk of future exacerbations, or immediately relieving and reducing the impact of symptoms as well as reducing the risk of future and adverse health events such as exacerbations. These dual goals emphasize the need for clinicians to maintain a focus on both short-term and long-term impacts of COPD on their patients. A framework for COPD management that matches individualized assessment of the disease and these treatments objectives will better meet each patient's needs.
What is COPD?
Chronic obstructive pulmonary disease is a common preventable and treatable disease. Is characterized by persistent airflow limitations that is usually progressive and associated with an enhanced chronic inflammatory response in the airways and the lungs due to noxious particles or gases. This definition does not use the terms chronic bronchitis and emphysema, and it excludes asthma. These are severe reversible airway limitations. Symptoms of COPD include dyspnea, chronic cough, chronic sputum productions. Episodes of acute or worsening of these symptoms, exacerbations, often occur. Spirometry is required to make clinical diagnosis of COPD. The persistent airway limitation and thus of COPD.
What causes COPD?
Worldwide, the most common encountered risk factor for COPD is tobacco smoking, outdoor occupational, and indoor air pollutions. The later resulting from the burning of biomass fuels are other major COPD risk factors. Non-smokers may also develop COPD. The genetic risk factors that best document is a severe hereditary deficiency of alpha-1 antitrypsin. It provides a model of how other genetic risk factors are thought to contribute to COPD. COPD risk is related to the total burden of inhaled particles a person encounters over their lifetime. Tobacco smoke include cigarettes, pipes, cigars, and other types of tobacco smoking popular in many countries, as well as environmental tobacco smoke. Indoor air pollution from biomass fuels used for cooking and heating in poorly ventilated dwellings, a risk factor particularly that affects women in developing countries. Occupational dust and chemicals, vapors, irritants, and fumes, when exposure are significantly intense, or prolonged. Outdoor air pollution also contributes to the lungs' total burden of inhaled particles, although it appears to have a relatively small effect on COPD, affecting causing COPD. In addition, any factors that affects lung growth during gestation and childhood, like low birth weights, respiratory infections, etc., has a potential to increase the risk or increase an individual's risk of developing COPD.
I wonder if Miss Tubbs has ever smoked tobacco.
Earlier I mentioned that Mrs. Tubbs is well known to our department. She has been a patient here several times over the last few years. Since she is a heavy cigarette smoker, she typically smokes 2 packs per day and has been doing this for about 20 years. That gives her a 40 pack year smoke history. Part of our department is smoking cessations. Protocol is to identify all smokers and encourage them to quit. We've tried counseling her about smoking cessation during each hospital visit, but she has not been very receptive to the idea. Since I am also the department's tobacco cessation specialist or counselor, I will review the 5 R's with her to motivate her to try to help her quit smoking.
I've heard about the 5 A's of smoking intervention, but not the 5 R's.
We use the clinical practice guidelines, or the CPG, for treating tobacco use and dependency. It was updated in 2008. It recommends using the 5 R's of motivation for a patient who are unwilling to make the attempts to quit smoking. The 5 R's are relevance, risk, rewards, roadblocks, and repetition. Relevance is to encourage the patient to quit smoking, and it's what is relevant to the patient. Why is it relevant to you to quit smoking? A lot of times they'll think about the patient's health, risk factors, family, and social situations to help for relevance. And then risk, the clinician has the patient identify what risk smoking is causing. Risk to their health, what are the negative consequences is what risks is. Rewards, ask the patient what would be rewarding about quitting smoking. What will it do to their health? How will it improve their life? Roadblocks are things that could prevent the patient from quitting smoking. And then repetition. The patient goes over, they make a list and they go over what is important to them when they are feeling a moment of weakness and wanting to smoke. So they just repeat the positive and why they want to quit smoking, and that helps them to quit smoking. If a patient desire to quit smoking and would like to try nicotine replacement therapy, I can recommend several products such as nicotine gum, nicotine lozenges, nicotine nasal spray. There's also a nicotine transdermal patch, a sublingual nicotine tablet, or there's a nicotine inhaler. If a pharmacological agent is preferred, there is bupropion SR, baricillin, or nortriptyline can be suggested.
Wow, I didn't realize that RTs also provided smoking cessation counseling. Can't wait to observe your interaction with Miss Tubbs. Can I ask you another question?
Absolutely. I love answering questions. I am a teacher at heart. I love being a respiratory therapist. It is making my day to be able to share what I know with you.